Hi there. We're going to have a conversation today about some topics relating to men's health. And I'm Dr. Jeremiah Stevens. We have also Dr. Shawn Postma and Dr. Kimberly Free here. And we're going to have discuss a little bit about different aspects of health that pertain to men specifically. And just in general, obviously men's health is human health. So a lot of these topics aren't necessarily male specific, but we will talk about some things that are a little more male specific today too. So one conversation we wanted to touch into is the issue of low testosterone. And that is an issue that people do come to us quite a bit looking to investigate. Some symptoms of low testosterone include fatigue, loss of muscle tone, sexual dysfunction, brain fog, just lack of libido, lack of just energy and vigor to kind of do things in their day-to-day lives. And those are complaints that a lot of people have. And whether it's low testosterone or not, low testosterone can be the cause definitely of those things, but there can be a lot of other things. So we can just write off all those complaints as just a testosterone issue. We always have to do a little more thorough investigation because I've seen people thinking it's testosterone. We come in and we run tests and now their thyroid's really out or their adrenal system isn't working well. And so it is important to look at testosterone in the framework of an entire human being, human health situation. So there's blood tests. There's a couple ways to test for testosterone. There's blood tests and saliva tests are the primary two ones we use in our practice. And I think they're mostly equivalent. Some people argue that the saliva is a little better, and I could see that maybe is a little more true. Saliva tends to be more of a representation of your tissue levels, where blood can be a little more transient and change more rapidly. And we will see those changes quite a bit. If you do blood tests on someone at different times of the day or different days of within a couple week period, you can see some pretty rapid different changes. So a single low testosterone reading doesn't always mean it's that person's low consistently, and a single normal or reading doesn't necessarily mean they're not low. So sometimes it does help doing a couple readings, and the saliva testing in some ways could be a little more of a balanced representation too of a more of a long-term one. So I often will push the saliva testing. It also is easier to do. It's a single sample. You just kind of spit in a little tube and mail it back in, and they'll give you some readings on that. But they'll also look at a lot of different precursors, including DHEA, progesterone, and looking at estrogen levels too, which can be in play as well for causing some problems. So testosterone, it has a lot of functions in the body. And when it gets low, we can have a lot of problems like we were discussing there. So it does behoove us to investigate that. And if it is low and we're, the blood test or the saliva test is matching the symptom picture, then I do think it is worth intervening to try to get that up. And so there's a couple of different ways to do that. One is to give testosterone directly. And there's some benefits from doing that in some people. It can really make a difference, especially if levels are consistently really low over time. That can be a useful way to do that. There's a couple downsides potentially with using testosterone directly. And it's one of the reasons I don't often recommend it for people. I think it's often overused, and it can have some problems. The biggest concern I have with using testosterone directly is there's been some increasing research popping up, especially in middle-aged to elderly men adding testosterone, that it can really increase heart disease risk. And I've seen a few patients who have had heart events while they are taking testosterone. And again, small numbers, you can't necessarily link those two things, but there is increasing research popping up lately showing some linkage with adding testosterone later in life. And I think it may be some of the similar things we see with these women, adding estrogen and progesterone years after menopause seem to have increased heart disease risk as well. And so there is some natural progression that happens in life where these levels decrease over time, and to suddenly jump significantly high back to trying to recreate teenage levels of testosterone is a little bit out of the normal rhythm of where a body would go, and I think it potentially has some consequences. So I think it often may be a better approach to use different substances to try to get testosterone up more naturally. It also is a little bit, getting testosterone can be a little bit of a tricky process. It's a scheduled controlled drug by the FDA, and so it's harder to get prescriptions and things like that. Not impossible, obviously, because a lot of people are using it. So there's about 4 different approaches I've used to boost testosterone from a natural point of view without having to resort to using direct testosterone. And they seem to work really well, often for controlling symptoms. There are certain people who this doesn't work and they do need that exogenous testosterone in a prescription form. And so I'm not saying that this works for everybody, but this is often my approach to go to. First I'll say there's several herbs that we can use to boost testosterone. The main one I've had some success with has been maca root, M-A-C-A, and often that will kind of help with some of the symptoms of low testosterone in men. There's a few other herbs out there that people have used. There's a funny named one named horny goatweed that some people have seen some benefit with. Another one is tribulus. Often there's some testosterone boosting formulas out there that have some combination of those 3 with some others. So maca and the tribulus together seem to be probably the best combination I've seen for helping with testosterone symptoms, low testosterone symptoms. So that's something that someone could try. The second one I've often used is something called DHEA, which is a precursor hormone. The body makes testosterone from DHEA. I've used this a lot with women with low testosterone because that's the only way women can make testosterone is from DHEA. Men can make it directly in their testes. Women have to make DHEA, which is made in the adrenals, and then convert it into testosterone. But we can use DHEA to transition into that. There's another free hormone called pregnenolone, which the body can also uses to make testosterone. And so sometimes using some ratios of DHEA and pregnenolone can help boost testosterone more naturally, and not to these supra physiological levels where you're again jumping back to teenage levels. We're just doing this a little more gradual, which in my mind has a much more likely safety curve, safety issues, less potential side effects. The third way that I've used to treat testosterone is to use a different hormone, and it's given by injection, or we can do it sublingually, which is HCG, human chorionic gonadotropin. And there's quite a few testosterone replacement clinics who have gone to this approach, especially in California, where instead of using testosterone directly because of the likelihood of side effects, they're using HCG, and sometimes pairing that with a few other different approaches. But HCG it's normally only present during pregnancy, but we do see that it does boost testosterone levels, and I don't know the exact pathway that works, but I have used it on a every 2 to 3 day injection cycle for men with low testosterone, and often it really helps with a lot of the side effects, especially around libido, sexual function, energy, and we're using really teeny low doses that are really shouldn't barely anything into the body, and it seems to make a difference at those very low levels. And I think that is something that we can do that as well. And then the last one, which is probably I should have started as the first one, which is probably the most important thing, is just general lifestyle changes, which is things like exercise. Things like exercise is huge, especially weightlifting exercises where you're building muscle mass. That will really, there's definitive evidence that can help boost testosterone levels when they're low in the body. Pairing it with healthy eating. A lot of times what we're eating in our lives is contributing to our low testosterone. Different pesticides, fertilizers, and hormones in our foods can really cause some disruptions on testosterone. So I think that comes probably the most important place to start with all of this is to look at how we can eat better, how we can sleep better. Sleeping recharges the ability of the body to create some of these things, including testosterone, and then exercise. And then, just all those kind of basics of healthy living are really important for getting the body to start making its own testosterone again. Anybody else have any comments on that topic that they would like to go to?
I have seen with the supplement of testosterone the increase in cholesterol levels, increase in blood sugar, something that's worried me, increase in hematocrit, hemoglobin, and then sometimes to the white blood cell line. And that was where I became concerned because when we start talking about other conditions that can lead to, those have been some of the risks I've seen come up with direct supplementation of testosterone and present. And when you're talking about the DHEA, well, I have a couple of questions that I'd like to clarify on. When you're talking about DHEA and pregnenolone, what kind of dosages and things are you talking about that for people, and what forms are you giving them in?
Yeah, that's a good question. So DHEA usually is, I use very different doses for women and men. So for women, I often see, I think, get put on much too high of doses of DHEA. So if you go to the store and find a supplement of DHEA, or get one from us where we have our brand, or we can get a doctor's only brand, they usually come in either 5 milligrams, 10 milligrams, 25s. I've even seen 50s out there. Oftentimes I see women put on 25 milligrams, which I think is way too much for women, and it often causes some it just seems to cause mental unclarity. I don't know if the best way to say it. It just seems like women often don't feel quite like themselves when they're taking that much DHEA. So there's a blood test specifically you can test for DHEA levels in addition to testosterone levels, or it's shown up on that saliva panel. I usually use DHEA sulfate blood test to see what those levels are looking like, and we can treat. But women, I often will treat in that 5 to 10 milligram range, and I often think that works better. Men often need significantly more, and that's where that 25 milligrams to 50 milligram kind of a day dosing often works better on that. Pregnenolone, it varies. I've used different forms. I often have had good success with creams on that, and dosing based on just the recommended levels and playing around with that. Pregnenolone is absorbed well through the skin, and so I've done the DHEA. I've usually used capsules. Pregnenolone, I've often found just a pregnenolone cream that applies. And so pregnenolone is sort of the proto-hormone. The body can make almost any hormone off of that. And so it can be a way to do that as well. So I've just kind of used like small doses of this cream just to kind of give some precursors for the body.
Okay, thank you. And also, too, you said very low doses of HCG, because I've seen the HCG clinics and things used mainly for weight loss. Is it that kind of dosages, or what kind of dosages are you talking about for the boosting testosterone?
Yeah, correct. So yeah, it's similar dosing to that weight loss protocols, and I think that's where a lot of this has kind of come out. This new treatment approaches, because people have found that using HCG during weight loss, often the side effects people notice even though they're dieting and very calorie restricted, often seem to sometimes gain muscle mass. And one of the side effects most people note when they're doing it for weight loss is an increase in libido. And so that's some things that people noted. HCG, if you're a professional athlete or, getting drug tested for athletic performance, is actually a banned substance because they know it increases testosterone. So people have abused that. Again, we're using such teeny doses, and it's it's a prescription drug that we're using off-label for this. Its main label use is to increase fertility purposes, but we found that we can use it to boost testosterone as well. And so I've often found using like 200 units, which is such a teeny amount, every 1 to 3 days, often is sufficient to raise those testosterone levels. I mean, during pregnancy, a woman, by the middle of a pregnancy, a woman's excreting over 1 million units of HCG a day in her urine. So this is like such a teeny dose. It's basically the amount of HCG in a pregnant woman the first day she's pregnant before she even knew she was pregnant. But there's something about just even those small, tiny doses that can have an effect on the body in raising testosterone. And I've seen serial numbers where we've looked at people's blood tests for testosterone that's low. We give them HCG every 2 to 3 days, and then subsequent readings show higher than than before. So it will trend things in the right direction even at those really teeny doses.
Great.
All right.
Thank you.